Topic. Case the 20, 17, and 18 years old woman with acute liver failure by Melissa Lara, teacher John Moscoso. Definition. A. The 18 years old woman presentation the with acute liver failure the totally the bilirubin was 1917 milligrams per deciliter. There days early that she had the received a diagnosis of the bronchitis and was treatment with anesthesia and diagnosis was made.
Hi, I am Dr. Ravichan Siddhachari. I am a consultant hepatobiliary and liver transplant surgeon for Manipal Hospital Group, Bangalore. Acute liver failure is a condition when one person who has got a normal liver develops disease and which causes so much damage that he becomes very sick very soon and gets admitted to intensive care unit. And if you don't perform a liver transplantation within days, he is going to die. So this is usually due to hepatitis A and E in our country. These viruses cause acute liver damage. Normally 95 to 98% of patients with hepatitis A or E, they recover spontaneously. Hardly 1 to 2% of the patients suffer from acute liver failure, wherein the patient gets very sick, and in these conditions you have to perform a liver transplantation to save the life.
Application in the nursing. People that will accord the liver failure and the treatment in the intensive care unit of the hospital. When the possible, your doctor will work to the treatment acute the liver failure debut in the main class the treatment in lowest control complication and heavy the liver time to head in the last case of the treatment in liver transplantation.
We don't know when acute liver failure begins. And we don't know how it evolves over time. So we are catching it in a point that they're either going to get better or get worse or stay the same for a period of time. Acute liver failure is rare. There are probably about 200 to 250 cases a year. It accounts for about 12 to 13% of the liver transplants in pediatrics. Because of its rarity, the NIH was interested in trying to understand acute liver failure better. No one site, no one center is going to have enough patients to study acute liver failure. And so we put together a consortium in 1999, initially with about 21 centers in the United States, Canada, and the United Kingdom, to try to look at this. First of all, the diagnoses of acute liver failure vary by age. So what we've been able to find is not only is acute liver failure different from adults, completely different from adults, but it's very different if you're less than 3 months of age, whether you're a child between 3 and 5, and whether you're an adolescent between 12 and 17. The diagnoses are completely different. So one has to tailor the diagnostic strategy by age group, which is very important. There was a presumed treatment for acute liver failure using N-acetylcysteine, which is a treatment for acute Tylenol or acute acetaminophen toxicity. And it was applied to patients who did not have acute acetaminophen toxicity. And in the adults who studied that same drug, they found that it might help adults who had minimal amounts of confusion or encephalopathy associated with their liver failure. So we studied it in kids, randomized it to placebo and treatment in 184 children with acute liver failure. What we found is that N-acetylcysteine first did not help them survive 2 years with their whether they were transmitted or not. But it made it worse in patients who were less than 2 years of age. So the placebo group did better than the patients who received the N-acetylcysteine. What's important for physicians to know is, first, diagnoses vary by age, so it's important to focus the diagnostic strategy depending on the age group. The second important point is that N-acetylcysteine is not helpful in non-acetaminophen acute liver failure.
Pros. The most common causes of the chronic liver deferring are viral hepatitis and drugs. Acute liver failure is the characterized by jaundice, coagulation, and encephalopathy. Complication and the treatment aggressively, usually intensive care units. Cons. Pertain entry to the intensive care unit. Reference to health center with hepatitis. Transplantation is available. Enlistment of the patient for the transplantation in the case that is working in the place with the availability according to the criteria in the user. Using a plane in the Ecuador. Acute liver failure is the most often the cause of B drugs and the virus that produces hepatitis. The main manifestations are the houses, the coagulopathy, and encephalopathy. Is the incidence the Islam 10 case per million people per year. The treatment is mainly supporting something the with liver transplantation.
In Liver Talk today, we're going to talk about acute liver failure. Acute liver failure is basically liver attack, quite like a heart attack or a brain stroke. It affects the person just suddenly over a matter of few days. A person who's perfectly well and healthy before is suddenly affected by acute liver failure, which is usually due to hepatitis E or hepatitis A or hepatitis B in adults, and a disease called Wilson's disease, which is basically copper metabolism gone wrong because of an enzyme deficiency in children. And what happens in this is that the person suddenly gets deep jaundice, starts to develop coagulopathy, which basically means bleeding tendency, and slowly goes into a confusional and drowsy state, and then goes on to pre-coma and coma. Now, such a person obviously needs to be referred urgently and cared for in a liver service or an advanced liver disease center. Some of these patients can actually be treated medically and they get well over a matter of few days to weeks, but a large number of them need an emergency liver transplant to cure them. Otherwise, they would lose their life. At Medanta Liver Institute, we have a special rapid response liver failure team where we receive calls from patients' families, referring physicians and hospitals from all over India and even abroad, and transport these patients by air or road ambulance as appropriate to our liver service, where they can be cared for in a specialized liver ICU with medical treatment, or we proceed for an emergency liver transplant if necessary.
Conclusion. EAN is a serious entity and association that will report the prognosis. The etiology is varied, but it isn't the genesis dominante. Viral hepatitis and poisoning B paracetamol is the characterized by its intensive septicemic inflammatory repose and multi-organ diffusion. Is the integral and the multidisciplinary management in the ECU is fundamental in ensuring the good evolution of the bacterium.
For the past 30 years, Nancy Concannon has dedicated her life to nursing. But in March last year, she was the one who needed help.
There was nobody sicker than I.
It was just a normal day for Nancy. She was getting inside her car, and she was on her way to work. And when she got inside her car, she looked up at the rearview mirror and realized that something was very wrong.
I had bright yellow eyes, and I was like, something's going on.
Doctors told Nancy her liver was failing, and fast.
She's been, the main person in my life for a long time, so it was just really difficult to thought that, the best friend wouldn't be there.
Alyssa Mon is Nancy's daughter. Doctors told her that without a transplant, her mother wouldn't make it.
She was very sick.
Dr. Johnny Hong says Nancy's situation was so dire, she immediately shot to the top of the transplant waiting list.
Typically, if they don't get transplant within a week or two, their risk of death is close to 100%.
But remarkably, just 10 days after she got sick, doctors found a matching liver.
The thought of getting a transplant this past was almost impossible. There just aren't enough organs to go around. I am so thankful, of course, first of all, to my donor.
A year and a half after her brush with death, life is back to normal.
I feel wonderful. I really feel wonderful.
And with many years ahead of her, Nancy has big plans for the future.
I guess there's more I have to do. And that's the only way I can look at it.
In Wauwatosa, Tim Elliott, WISN 12 News.
Nancy and her family are now advocates for Donate Life, an organization dedicated to getting more people to become organ donors. Now, for more on this condition, acute liver failure is loss of liver function that occurs rapidly in days or weeks, usually in a person who has no pre-existing liver disease. Symptoms can include jaundice, bleeding easily, swollen abdomen, and sleepiness. Doctors usually try to save whatever part of the liver may still be functioning, but usually a transplant is required. Fewer than 15% of people diagnosed survive.
Nothing more, thank you.